Of course they knew that they were going to have to raise taxes if they were going to do anything for public services. And the idea all the way through that election campaign, and this was true of the Conservatives as well, the idea that you could go through that campaign and say, we will not raise taxes beyond the trivial things that they had in their manifesto, and that will fund everything we want to do, was completely and patently absurd. And we said so at the time, and so it has proved.
Paul Johnson is back. Hello, Paul.
Hi.
It's lovely to have you back. Obviously, director of the IFS, which you've been doing for how long now?
14 years.
14 years.
And how much longer have you got left?
Another 6 or 7 months.
Because you are abandoning ship. You're abandoning the UK. This is terrible. You have been the voice of reason when it comes to public finances, and God only knows what kind of chaos will ensue once you've moved on.
I'll still exist, Robert. I'll still exist.
Will you still be commentating?
I hope so. I hope if people like you keep asking.
Yeah.
Well, we do.
Are we
going to ask him
should
back?
We ask?
Once he's not got the title, we might ask him back. You never know.
It depends how this goes.
You never know. It depends how today goes, I suppose. I think we wanted to kick off actually by looking ahead to the spending review. You've made the point that in the end, the budget, we'll come back to it, was absolutely not a reforming budget. But there's this other really huge event coming up when it comes to putting public services on a stable footing. How important will this spending review be?
Well, this is going to be much tougher even than the budget. And one of the reasons I thought the budget didn't do actually as much as I expected it to do is it really kicked a lot of hard problems down the road. And in particular, it kicked down the road the problems about what spending's going to be after next year. So what the budget did was set out, this is how much money we're going to give the health service and schools and so on this year and next year. And then it said, well, we'll set the overall envelope for the rest of the Parliament after that. So how much are we going to increase total spending by each year after next year? And whilst it was pretty generous this year and next, the envelope for the years after that was really very tight. What do I mean by that? Rachel Reeves said, I will increase spending by just 1.3% a year on year after next year. Well, that's a real increase. That's not nothing. But we know that the health service will get more than that because the health service always gets loads more than that. And because that's by far the biggest total.
And remind people what share of public spending these days
if you look
is taken by the health service.
If you look at public service spending, so spending on stuff as opposed to debt interest or paying benefits and so on, it's more than £4 in every 10 that we spend, and that's up from
40% of every bit of public service spending goes on the health service.
Exactly, and that's up from about a quarter just 25 years ago. So it's taking a bigger and bigger share. So over the last Labour government, everything was going up, but the health service was going up faster. During austerity, most things were going down, but the health service was still going up a bit. So it's just gone higher and higher as a fraction of the total.
So when you put their spending up by more than 1.3%.
It leaves nothing for everything else. And particularly when we know that defence will have to go up, at least in line with the size of the economy, and we've got commitments for things like childcare. At best, actually, it will leave nothing for everything else, and you could actually argue that it will result in some cuts in other departments. So this is going to be a really tough spending review. And in the budget, Rachel Reeves said that she would hold it in late spring. That's been clarified to mean June.
Very spring-like June, isn't it?
Well, late spring stretches probably to September in Treasury speak. But this is going to be tough. And we had reports that even this year, there were quite tough negotiations with secretaries of state about what they were going to get. And this was a world in which they were, on average, getting quite a lot. If they really do keep to this 1.3% a year in total through the spending review,
I detect in your voice when you say "if," you're not convinced that they will stick. You don't think they can stick to it.
It's going to be really tough to stick to that. But of course, the Chancellor has hemmed herself in. I mean, she has said no more tax increases, and then she seems to be slightly unsaying that. But she's also right up against the limits of her fiscal rules. So no borrowing other than for investment. Well, she's meeting that by the tiniest of tiny margins. So things might move in her direction. The forecasts might get better. The economy might grow more, and that will make things a bit easier. But there's an equal chance that they won't go in her direction.
And at the same time, obviously, we're talking about how much the commitment is to the NHS. But even this week, we're talking about the problem with the prison service. And there's loads of other areas, aren't there, where it's going to need more money. and, well, probably need reform, which costs money. And is that going to be able to happen?
Well, there's a lot more money this year and next, and actually very unusually. I mean, in terms of billions of pounds, the health service got loads, 22.
And can I just ask you, the 22 billion that's going in for these 2 years into the health service, put that into some kind of historical context, because when I talk to people in the health service, they say it's very welcome, but they don't believe it's transformative.
Well, that's the trouble with something the size of the health service. I mean, we spend getting on for 200 billion a year on it, so 22 billion over a couple of years is, it's 10%. It's a significant increase. In historical perspective, it's a sort of average scale of increase that we've had over the period of the health service. So it's significant, and it will be enough to keep things going. And actually, productivity this year in the health service has improved after catastrophic period since 2019.
Where are we seeing those improvements in productivity?
Well, we're seeing that actually the amount of activity, the number of operations and so on has gone up this year.
Relative
it's actually got
to the amount that's going in
relative
terms
to the
of
number
money.
of doctors and so on.
Outputs are increasing relative to funding.
Yeah, but this year it's still down well down relative to where it was in 2019. But after 4 or 5 years of just down, it's actually started to tick up this year. So there is some good news. There is some movement in the right direction
with
there.
COVID in terms of.
We haven't caught up in terms of where waiting lists are, in terms of the degree of productivity and all those sorts of things. We are at least now doing as much as, maybe even a little bit more than we were back in 2019, but with an awful lot more. It's something like 15 or 20% more doctors and nurses and so on, and only a little bit more in the way of activity.
I want to come back to the challenge of improving public services outside of health and defence, on the basis of what look like very tight budgets in a minute. But I just want to drill down a little bit more on the challenge in the health service itself. One of the things that you and I grew up with in terms of the prevailing view about the health service, the NHS, was that although in some respects health outcomes in the NHS were a bit worse than in other European countries, for example, and in other developed nations, nonetheless, the NHS looked very productive. The share of GDP being taken by the NHS for pretty good outcomes, if not world-class outcomes, was still pretty good. One of the things that has happened over the last, really quite long period now, 10 years, is that productivity, as we've been talking about in the health service, has collapsed. And what that means is we get way worse outcomes, particularly for things like cancer treatment in the UK, than many other countries. But we are spending a colossal amount of money. It's no longer value. Those bad outcomes are straightforwardly bad, including being really bad value for money. I suppose the question is there something in your view now that we have to face up to in terms of the structure of the health service? What are we doing wrong relative to other countries?
Well, that's a really tough question. In terms of what's happened to productivity in the health service, if anything, it actually did grow over the 2010s, partly because the budget was squeezed, and certainly for the first half of the 2010s, outputs were rising faster than inputs, and it's doing so much more than it was, even 20 or 30 years ago. The demands on it are
But I'm just talking about relative to outcomes in other countries, which seems to me to be the relevant point.
You're absolutely right. We've had this collapse in productivity since 2019. But one of the things that's really depressing about our health system is that, we all worship at the feet of the NHS, but it is not a good health service relative to what people in many other countries experience. And you're exactly right. In terms of curing of all sorts of cancers and so on, we are not particularly good. Our life expectancy is not particularly good relative to that in lots of countries. Well, I don't know the answer to that. In terms of our life expectancy, there's all sorts of things that go on here that go way beyond what's happening in the health service. And it's worth saying, in lots of countries, in the UK, we had big increases in life expectancy all the way up to about 2010, and then that's really slowed down since
and in
then.
some parts of the
actually,
UK has gone into reverse. There are some parts of the UK where people are dying much earlier.
Yes, I mean,
it seems to be massively associated with poverty.
Health inequalities have grown.
Yeah, it's my area, isn't it? It's where I live in the northeast.
Certainly big regional differences there. Now, if you compare our health service with most other countries, we are not unusual in having a system which is effectively publicly funded and effectively broadly free at the point of use. A lot of other countries have some upfront payments and insurance and so on, but broadly speaking, it's not terribly. I mean, it's not unusual to have essentially a free health service. And one of the things that drives me absolutely mad is when people say, "Oh, well, at least it's not the American health service." Well, no, it's not. But then, nor is any other health service in the developed world the American health service. What we should be comparing ourselves to is the French or the Dutch or the German health service or what have you, which are not along those American sort of private insurance lines, which is incredibly inefficient. I mean, great if you're rich in America, you've got great healthcare, but my goodness, it's expensive, and if you're poor, it's a real struggle. But across most of continental Europe, you've broadly speaking got publicly provided healthcare, maybe a social insurance model, but in terms of people's experience of it, they would experience it as something that they can they can get to when they need it. Now, what's different about ours? I think one issue is it's just kind of a single sort of massive, incredibly hard to manage thing. Another is we have underinvested in capital, so we spend actually a sort of average amount as a fraction of national income now on our health service, but for the last 10, 15 years we spent less on building operating theatres, buying MRI scanners and all those sorts of things. So we've got less stuff and we've got fewer beds than most of these other countries. So we're running at capacity all the time. And one of the things that surprises me, we just do less management of it. We've got fewer managers, we've got probably less high quality, less high powered direction and management of the health service than you'll get in other sectors. And of course, that's politically unpopular. All politicians say, well, let's just cut out the management. Well, actually, we're undermanaged. We're not overmanaged as a health service.
That's really interesting you say that, because my mum worked in the NHS for like over 40 years as a radiographer, and she said the worst thing that happened was management coming in and having too many managers. So, in terms of people who didn't understand what their job involved. And
well, it may you can be undermanaged both in terms of the numbers of people, but also in terms of how good the management is.
Is it not also about the fact that we do less preventative stuff? So we're not as good at the beginning about teaching you about being healthy and eating well and everything else. So
we're actually, on terms of things like vaccinations, we're actually really good. I mean, if you look at sort of some of the international comparisons, one of the things we come out really well on is preventative stuff like vaccinations. But I mean, going back to what you were saying about inequalities, I think we are, in European terms, a pretty unequal country, both regionally and locally. And we know that, when you've got inequalities, people towards the bottom of the pile tend to do significantly worse in terms of their health. So we're probably putting more pressure on our health service than some other
I mean, the Marmot analysis of all of this is absolutely devastating in terms of health inequalities in that sense.
And I think broadly speaking, I mean, Michael Marmot has written a number of reports which essentially say we've got these massive health inequalities, and he comes to a set of recommendations which essentially we need to transform society. I mean, I'm sort of exaggerating. And at one level, he's sort of right, because I think each step up the social spectrum you go, or the income spectrum, or whatever you want to do it, the healthier you are. The gap in healthy life expectancy between sort of people in the top 10% and the bottom 10% is huge. It's something like 20 years in terms of healthy life expectancy, and there are some incredible numbers in terms of people in their sort of around the age of mid 50s to mid 60s. If you're in the bottom group for wealth as opposed to the top group for wealth, you're probably going to live 15 years less long. I mean, these are huge differences between these different groups, and it reflects everything from literally what happens in utero, kind of your mother's sort of stress and behaviour and smoking and so on, and then early childhood, and then of course if you're in a low paid or insecure work, you've got lots more stress. You might be living in a less healthy environment, and all these things build up within the body over time, such that and then you may have less access to health inputs, appointments and so on. But the big issue is not really about the health service. Poor people use more health service than better off people because they are less healthy. But these health inequalities are absolutely huge.
But I mean, there's also, as you say, the under-investment, for example, in kit like scanners, but also there seems to me to be still, this is actually something I looked at in some detail when my late wife got cancer, and I did a bit of campaigning on this after she died. And, what one of the things that has been a long-running problem in this country is simply detecting cancers early enough. And she was a non-smoker and was diagnosed with lung cancer. But, even though she had certain conditions for a while, nobody thought that it might be, because quite often lung cancer is asymptomatic, but she had cancer, symptoms that were consistent with it. It took months for her to have the kind of, x-rays and scans that could have picked it up really considerably earlier. And there are a number of issues here. It's partly awareness on the part of patients. People who are suffering from things often don't go to the doctor early enough, and then doctors themselves historically have been reluctant to send people off to have the kind of examination, scans, and all the rest of it that would pick stuff up. The earlier you pick up cancer, the easier it is to get rid of it, and actually the cheaper it is for the health service, because when you pick up a cancer late, not only is it incredibly hard to save somebody, but in the process of not saving them, you're spending an absolute fortune in terms of really expensive treatments to try and prolong life for just a bit, as it were. And somehow we just don't, and other countries are just so much better at picking up cancers early enough to sort of deal with them to really massively increase people's life expectancy.
Yeah, and I think this reflects, it is worth saying that the one thing that picked up reasonably quickly post-COVID was diagnostic interventions for potential cancers. That's the only thing that picked up post-COVID. Everything else we had lots less of. So that at least was some slightly positive story. But a lot of this, I think, is down to the difficulty in accessing primary care. In other words, GPs who, we have had promise after promise after promise for decades that primary care, preventative care is where the money would go, and it never has. There are no more GPs than there were 25 or even 30 years ago. There are more than double the number of hospital doctors than there were in that period. So all of the investment has gone into that one end. So that creates a bottleneck. And we've all experienced difficulties even getting to see our GP. And then what you don't have, which you will have in many other countries at a sort of well-stocked GP surgery, is the capacity to do an X-ray or the capacity to take blood and have a look at it and so on. So the whole system becomes much more complex.
So how do you sort it out? Like what does Rachel Reeves need to do, and can it be?
Well, it's Wes Streeting is
in terms of money, but
on the health service, I genuinely don't know. It's such a complicated, and one of the problems we have is that I can explain to you how the school system works. I can explain how university works. I can explain even, the intricacies of our, big parts of our tax and pension system. I literally cannot explain to you how the health service works. And actually, you need to have worked in it for 20 years actually to kind of really have a sense
what do you mean by
of
that?
How that goes.
I'm both fascinated and horrified when you say it. What do you mean you can't explain it?
Well, there are so many, and I can't remember the numbers. There are lots of different ways in which money flows through the system. There are lots of different tiers of management in the system. There are, 20 different regulators in the system. There are different sorts of ways of determining how much people get paid for things. private companies who try to work with the health service find it incredibly difficult to engage with the procurement processes and all of those sorts of things. It is just a massively complicated system. And,
just to be absolutely clear, more complicated than it needs to be.
Well, I think so. But again, it's really hard to tell. But, there are, what are there, 1.5 million or whatever the number are, people working in this organisation. It's probably wrong even to think about it as an organisation. It's just so vast and takes up such a large part of the economy. And I think at some point in the next decade or two, I think if it follows the workforce plan it's following, I think something like 1 in 10 of everyone in work in this country will be working in the health and social care system. I mean, this is just extraordinary.
Well, it's the biggest employer where I'm from in Middlesbrough by far. That's where all of our parents worked. It was either the steelworks or the hospital or in some type of social care setting.
Throwing back to really where we started from, whenever I speak to Rachel Reeves or Keir Starmer about the outlook for public services, they genuinely insist the 1.3% overall increase is all there is. And they insist, this is, as I say, after the next couple of years, the 1.3% limit on how much they're going to spend overall on public services. And they say two things. One is that it's realistic. And second, there's not going to be any more. Actually, there's a third point they make, and this is the point I want to talk to you about, which is they keep saying, and reform will sort everything, right? And they keep, they don't tell us precisely what they mean by reform, but it is their watchword of the moment. That at a time when money is tight, everything's going to be okay because the way that we deliver public services will be changed to make all of them more efficient and productive. And I guess that's just I want to ask you, since you're the person who has been more steeped in this part of the economy than pretty much anybody else in the UK, and you'll have heard other governments talk about reform. How much can they genuinely achieve and over what timescale?
Well, I think there's two parts to that. I mean, any of us who have used public services know that they could be better and they could be more efficient, and that that is true with that is true in spades for the health service, but it's true of most other parts of the.
And but they're talking about this
well.
across the piece. They're not just saying health; they're saying everything.
So we can all see that things need to be and could be better, but that's super easy to say, but incredibly hard to achieve. I think it was was it Duncan Robinson at The Economist who coined this term, the reform fairy, to go alongside the magic money tree. You kind of wave your magic wand and everything will be reformed and better. Look, of course, there is need for reform of some kind, but it's an incredibly hard thing to achieve. And we have seen different sorts of reforms across different sorts of public services over many years. I mean, in a way, the school system is quite different in many ways to where it was 20 years ago. There's lots more accountability. It's actually in some ways become more effective. We've had reforms to the health service. I mean, Andrew Lansley under the last government introduced kind of massive structural reforms, which were a bit of a disaster. And that's a kind of a real lesson in not trying to do anything too big too quickly, and actually really trying to understand properly how things work before doing this. But I mean, I come back to how you make this reform. I don't know, and I don't think the government currently knows how to do it. It's right to look for it, but can you rely on it delivering? No, you can't.
And when I mean, we're totally obsessed with artificial intelligence, and we can see within the health service very specific projects where AI can improve things. So certainly in diagnostics,
yes,
there are now all sorts of AI services which can massively increase productivity when it comes to diagnosis. But it's not yet clear to me that they actually have a plan to use AI more broadly to increase productivity. It's an easy thing to say, but I think we're quite a long way from seeing the detail of it.
But again, when it comes to tech and IT and so on, I mean, the health service needs to be dragged into the 21st century before it sort of really starts relying on AI. I was part of this health commission that the Times newspaper set up a couple of years ago. And we talked to lots and lots of people across the NHS, and I think anyone who's worked there will recognise this. The tech that they're using at the moment is, they pretty much all said, look, I just want a computer that will turn on and talk to the other computers in my hospital, and that doesn't take me 20 minutes every day to log in, and doesn't have 6 different systems and where I can share the data, and all these kinds of really basic things before, we probably need to do alongside getting towards AI, but they're so far behind having an effective system at the moment. So the 2 things I took away from that, one was just how terrible the sort of tech was, and the other was how badly managed people felt they were. Yeah. That they, in every sort of sense, that you'd be on night shift and there was no coffee available, or that the canteen was closed, or that you couldn't book time off for your best friend's wedding, or whatever it was, that actually you were treated really badly as a person within the health service. And I mean, you look at the staff survey results, they're generally pretty terrible. And you speak to lots of people who work there. Well, of course, this is not true for everyone, this is not true universally, but there is a problem about the way people are managed, and there's a problem about the way that tech is managed and used.
It's so true, that, isn't it? About, we're talking about AI and all the kind of amazing robotics and things like that might happen, but really, even the interface for booking a GP appointment is out of date, isn't it? Or, it's kind of, you're talking about
variable.
Yeah. And I think it's important that, because everybody will have their own experiences of, different public services which just feel so massively behind the time. I mean, I attracted a bit of attention the other day on social media when I talked about having my phone nicked.
Yeah.
This is a few months ago, and the police simply refused. I told them where it was, because the GPS from my other devices told me exactly where the phone had been. It was snatched from me in the street or by a biker, and I went straight to find my iPhone, could see where it was, sent the police a Google Maps picture of the front door, and they just wouldn't go. I mean, they and their explanations were one, there's just too much street crime, we can't deal with all of it. And the other one was, and by the way, we're not allowed to use GPS data to obtain a warrant and go in. But what they could have done is they could have gone round and just asked politely, they could have banged on the door and just asked politely, we think there may be...
But they'd be doing that all day, because it's
but
like
they won't do it. But they won't do it at all. They simply won't
they're not
do it.
allowed to use GPS data.
They're not allowed. They are not allowed to use GPS data to get a warrant. No, they're not. I talked to the Home Secretary about this, and she, I think, has announced that they are looking at a change in the law to allow the police to use GPS data. But it is sort of mad that the product, if you could use GPS data on all sorts of things, the productivity of the piece would definitely improve. But secondly, I don't know if you've ever had a statement taken by the police recently, right? What they ought to do is record it and then use
save all the writing out.
Yeah, I mean, honestly, I had to give us. It took someone like 2 hours, because they have to write down it. It just takes forever. Whereas in our daily lives, I use AI transcription services. It produces a perfectly reasonable transcript in about a millisecond. All they have to do is take the voice recording, convert it into a transcript, show it to me. I can then say, well, I didn't say that, and just make the odd correction. And a process of taking a statement that currently takes 2 hours would take about 3 minutes.
I feel like this has turned into a therapy session for you, Robert, hasn't it?
No. This is all about public productivity improvement.
My friend's a police officer. I was talking to him about this very thing actually last week, and he was saying it's amazing how many crimes they solve by Ring doorbells now, though. So they are able to use that. They use that to solve loads of...
What, because they've got the CCTV?
Yeah, because everyone's filming everything all the time, so they can get... anyway.
And that is definitely working, is it?
Yeah, well, that's what he was telling me. Yeah, I mean, it's one police officer out of many, so there'll be others who might
well,
say
I mean, I have to
different,
say,
but-
because I have to say that again, locally where we live, people, supplied precisely that kind of CCTV, and the response back from the police was, "Well, yeah, we can sort of see them, but it's not going to stand up in court." And
that's
therefore,
the
they
Met for you. No, I'm kidding. Should we move on? Because one of the things, there'll be something else he'll need to get off his chest, I'm sure.
This is all very constructive debate. This is not. I mean, obviously, some of it is always on this programme, personal therapy, but.
The thing I'm really interested in about what is the jobs market and this sense of, the government desperately wants to get all these economically active people, get as many of them as they can back into work. And at the same time, obviously, we've had a budget that's made it more expensive for employers to employ people, particularly the young, the low paid, part-time workers. And then there's an employment rights bill as well, which organisations are saying is making it riskier for them to take people on because of the rights from day one and everything. So do you see this how do you see this playing out? Do you think this is a kind of conflict of policy? And is it, what's going to happen?
Well, let me get something off my chest
Go on.
first then, which is we don't know what's going on in the jobs market because the Office of National Statistics survey of this stuff is absolutely useless.
Why?
They're managing to get a tiny number of people actually to respond to their survey. So we don't actually know how many people are in work or how many people in particular are out of the labour market or unemployed or what have you. I mean, we're just working in an incredible fog.
Can I just ask you a question about that? Because there is literally no more important piece of information when it comes to economic policy making than how many people are in work and how many people are out of work and why. It is, I mean, what is the point of, any economic system? It is to provide ways for people to make a living. There's literally no more important piece of data. This absolutely cornerstone of all economic policy making has been, to coin a phrase, shit for, just ages now. What went wrong?
Well, it's called what we're talking about here is something called the Labour Force survey, which the response rates to that were falling over a period of time, and then through COVID, absolutely collapsed. Now,
when you say the response rates, people just weren't prepared to say.
People are not filling it in.
People not preparing to give the information. I've actually, a few years ago did this, and it takes a bit of time, and it's done over the phone. You can get a bit irritated with it because it's still asking 5 or 10 questions in there asking me if I was on a government training scheme, and I go, well, no, obviously I'm not on a government training scheme. Anyway,
maybe they were suggesting you should be.
Quite possibly, but partly, they moved away from doing this face to face, and they found the sort of phone systems much less effective. People are becoming less willing to share their information. I mean, obviously, far fewer people are using landlines and so on nowadays. And they're looking.
They never ring people on a landline still, do they?
I don't know, to be honest.
Yeah,
but,
I wouldn't even answer. Well, not that we have one, but if we did, I wouldn't even answer it if it rang.
Even I, and I'm not the frontier of tech, don't have a landline. But so the response rates to this have really collapsed. So you don't any longer get a survey which is anything like reflective of the population as a whole, and they find it very difficult to use the information they have got to make it look reflective of the population as a whole. Now we have all sorts of other information. Of course, we have tax data, so we know how many people are paying PAYE income tax, and we have benefit data, so we know how many people are receiving benefits and so on. But it's only through these sort of population-wide surveys you can put all of that information together and work out sort of who's on universal credit for what reason and whether they're paying tax and whether they're in work and who's out of work for what reason and so on. Now, coming back beyond the data, we know that we can exaggerate the problem with sort of numbers of people out of work. The numbers of people not in work have risen post-COVID, and particularly we can come on to this extraordinary increase in numbers of people on sickness benefits of one kind or another. But to come to your question, Steph, yes, I mean, we have had sort of three things which I think are risky for employment, particularly employment of people on lower earnings. One is a very, very big increase in the national living wage, the minimum wage. Now, to be fair, there's no evidence that up till now that's had any effect on employment, but there's clearly some risk there. Secondly, as you say, a significant increase in employment regulations are giving people more rights, which might make employers less willing to take people on. And then thirdly, this big increase in employer national insurance contributions, which in a sense, kind of rather ironically, it's about the only tax rise you could make, which is only going to affect working people, despite the rhetoric. But it was increased in a particular way, which meant that because the threshold below which you as an employer start paying was pretty much halved, this really hits people, employers who are employing people on low annual salaries. So often, and this is why the supermarkets and the hospitality sector have got upset about it, often people working part-time who might be earning 10, 15,000 a year, they may have quite low hourly earnings, but that's mostly because they might be not working very many hours. And so those employers who are employing people on relatively low pay, they're the ones that are going to be hardest hit.
Yeah. How's it going to play out, do you think?
We'll see. I mean, as ever, one can exaggerate the scale of these things. I mean, the national insurance contribution rise was a 20-odd billion rise in a 2.5 trillion economy. So I mean, one can overstate the scale of this, but for some people, this is going to make things. It's clearly going to make things somewhat more difficult.
And just to be clear, because there is actually conflicting evidence now about this. The narrative, if you talk to any politician, is that the big British problem was this rise in numbers of people either incapacitated and unable to work, removing themselves from the workforce, or choosing not to work. I recently saw some data which said, well, actually, some of this may be overstated, that actually the British sort of, workless problem may not be as great as everybody thinks. What is your view?
Well, we know that there's been a big increase in the number of people on the benefits, on incapacity benefits and disability benefits. I mean, something like a doubling in the number of people claiming each month relative to where we were 4 or 5 years ago. So that is definitely the case. Now, in terms of the
and your view is that the trend is unsustainable.
Oh, I mean, it's extraordinary. I mean, we're spending tens of billions more on this than we were not very many years ago. And actually, if you look at, so we're focusing on sort of working age benefits, but if you look at sort of the whole population receiving some kind of sickness benefit, this could hit 100 billion a year by the end of this decade. So that's extraordinary numbers. And clearly we can't, among working age people, we can't continue to see this number of people claiming the benefits, particularly because once you're on, you very rarely come off. Now, this is really hard. A lot of the people who are moving on to, or most of the people moving on to incapacity benefits have already been out of work for some considerable period of time. So once they're there, it's really hard to do things which will get them back into work. You need to catch them earlier.
And just to be clear, in terms of how you think of it, we talked earlier about how inequalities and poverty increases ill health. How much of this is just to do with the unfairness of the distribution of income?
Well, I don't know. I mean, it's worth saying that in terms of you look at overall inequality, despite this may come as a surprise to listeners, it absolutely just has not increased in the last 15 years. And if anything, it's gone down. I mean, minimum wages have gone up a lot. The earnings distribution has actually squished somewhat. So someone on minimum wage is doing much better relative to an average earner than they would have been 15 years ago. So in that sense, we've squished the earnings distribution a bit over recent times. It's still much more unequal than it was 50 years ago, but it's less unequal than it was.
But I mean, one of the things we don't
ago.
know is even if there has been, which there has, as you say, in terms of certain measures. I don't think it's true of wealth inequality, but it's certainly true, as you say, there has been a slight improvement in terms of income inequality. But what we don't know is when you have those levels of inequality persisting over years and years and years, whether in a sense the outcomes in terms of quality of life just progressively get worse.
Well, we've also, the other thing, of course, that we've experienced over the last 4 or 5 years is the cost of living crisis. Out of work benefits, if you're not on a sickness type benefit, are incredibly mean. Very, very low indeed. And so people have obviously had sort of, if you can get on, if you're out of work and can get onto these sickness benefits, then my goodness, it's worth your while to do so. You also stop getting hassled by DWP in terms of finding a job. So your incentive to find a way to get onto these benefits is very high. Now, I'm not saying that means that there's lots of people on these benefits who've got nothing wrong with them, but it does mean that if there's in a world in which you had more generous benefits or a slightly easier job market or something, you might not have bothered to go on to it, even if you had something slightly wrong with you. Now, if you can find a way on, then you're probably going to do so. And I say the real problem here is once you're on, people just don't tend to flow off again.
What the government want to happen is for the economy to grow and for that to kind of help us in terms of bringing in more tax revenues and everything else. But it doesn't look like that's going to happen. Where do you think growth's going to come from, and are we going to see it?
Well, it's a mug's game predicting what's going to happen to growth. I think there are some reasons for just general optimism.
Go on. I'm up for optimism. I definitely am. Working with EO, I am up for optimism.
Just in the sense that the fact we've had poor growth for 15 years doesn't mean it's always going to be poor. And it will change at some point, and economists will not predict when that point will be. We are coming out, I think, of the shadow of the financial crisis as interest rates are now at sensible levels as opposed to zero. Now, people might think interest rates are, the higher they are, the worse it is. Well, I think interest rates at what was effectively zero for a long time was actually really bad for the economy. Now, we need them to come down from where they are now to maybe 3%, but if that's where they settle, I think that'll be helpful. If we don't have any more crises, no more financial crises, no more COVIDs, no more energy price crises, no more Brexits, that will help a bit just in terms of stability. Maybe things will turn out okay or a bit better than we expect. But actually, on the other side, a lot of that is also sort of already built into the forecast. So the OBR is quite optimistic about the next few years. I reckon the economy will grow at 1.5% or so a year, which is not brilliant by historic standards, but which is not
should remind people
terrible.
That it's half the growth rate
Indeed.
from 92 to 2007.
It's still poor, and they've got very poor growth in household incomes, which is what really matters to people. Now, again, this is just a forecast, but if you look at the OBR's forecast, Office of Budget Responsibility forecast, at the budget, they reckon that people's household incomes will grow at 0.5% a year each year over this parliament, which will make it the second worst parliament in history, beaten only by the previous parliament. Now, the worry there is that, that does not make people cheerful. It does not make for a happy electorate that is going to be, happy with the sort of the standard offer of the standard parties. And we've already seen that in terms of where we've ended up with Brexit, where with the big votes for reform and the Greens and so on, people are more and more, I think, frustrated with the traditional offerings of the traditional parties. I think lack of economic growth, I think itself creates sort of political disparities. But in terms of where can growth come from, at one level, some of the things the government's been saying, I think, are in the right direction. We need to build more houses. We need to sort out the planning system. We need more public sector investment and so on. Now, there's more investment going in, though not particularly growth-oriented. They've said good things about planning and so on. We'll have to see whether they can deliver on that. But a lot of these things which we know are good for growth, it takes a long time to have that effect in a sustainable way.
Now, I have, however, got to take you back to the last time we spoke to you. It was before the general election, and it was a moment where actually I felt steam was coming out of your ears. Honestly, I felt I could see it, because what you said was everybody knows that whoever wins the election is going to be inheriting, one of the worst challenges in terms of the state of the public the state of public services, the requirements to put more money in, the choice will be between a lot more borrowing or a lot more tax. But the notion that, there aren't going to have to be some really difficult decisions taken is ridiculous. And both of these parties are in denial about the scale of the money that's going to have to be raised. And you then said, if whoever wins gets in and says, "Oh, I didn't know about any of this, and I've just found that there's this black hole that nobody told me about." I can't remember. You're always very polite, but you came close to
profanity.
Paraphrasing, you said you would not be impressed.
I think I said I'd be very rude.
Yeah, you did.
So you haven't really been as so now's your moment. Now be very rude about Rachel Reeves and Keir Starmer for claiming they didn't know about any of this.
Well, of course they knew that they were going to have to raise taxes if they were going to do anything for public services. And the idea all the way through that election campaign, and this was true of the Conservatives as well, the idea that you could go through that campaign and say, we will not raise taxes beyond the trivial things that they had in their manifesto, and that will fund everything we want to do, was completely and patently absurd. And we said so at the time, and so it has proved. Now, to be fair, there are some aspects of the so-called 22 billion black hole that weren't quite as clear, that Rachel Reeves talks about, that weren't quite as clear as the rest of it. But the big picture is that we knew that there wasn't enough money to achieve anything like what they wanted to achieve in terms of the public services. We've talked about the budget saying 1.3% a year increases after next year on top of where we are at the moment. Jeremy Hunt had put in 1% a year increases every year, including this year and next year. And the head of the OBR referred to that as not even fiction, because at least someone bothers to write down fiction. We knew it was nonsense that you could do what the parties wanted to do without substantial tax rises. And so it has proved.
Right, so we've got to wrap up. So how rude can you get?
That's not a question you've been asked very often.
Well, I can't say how frustrating it was going through that election, saying time and time again what was absolutely obvious to anyone who looked at it being denied by all the parties, and then us seeing that that's what happened. And then I have a particular beef, as it were, with the Labour manifesto. Did say very clearly, we will not increase income tax, national insurance or VAT, and then sort of claiming that increasing national insurance wasn't breaking that.
And that being the biggest thing they did.
But also the idea that doesn't somehow affect working people. When I say the only tax that I can think of that only affects working people is national insurance contributions. I can't think of any tax that doesn't affect working people.
He's not going to swear, Robert. He's not going to swear.
Dear listener, you're protected from the full force of Johnson's profanities. No, I think we got to wrap it up.
We do. Thank you very much, Paul. Lovely to see you as ever. That's it from us on The Rest is Money. Bye bye.
And guess what? We are going to invite you back.
Yeah. You've made it. You've made the cut.
Thanks, Paul.
Bye bye.
Thank you. Bye bye.